Hey guys, Mark Anthony here from MedTech World, and today's podcast will be featuring Michael Maylahn from Stasis Labs. Let's go! Hi Michael, good afternoon. Thanks for joining us today. How are you doing?
I'm good. Thank you for having me.
My pleasure, my pleasure. Michael, I'm going to jump right into it. Stasis. Can you tell me a bit about your background and what came to found Stasis?
So I'm trained as a biomedical and electrical engineer, and really spent my entire life exposed to the healthcare industry. My mom, my dad, my grandparents, my aunts and uncles, seems like the majority of the family was working in healthcare. And something that always really has bothered me is that access to quality healthcare has been so defined by socioeconomics and by geography. And if you look at the coming of the internet and internet being available, pretty much everywhere in the world, and then these very cost-effective, handy smartphones that now the majority of the world has, it completely changes the access that patients around the world that can have that historically have been underserved. So that's really been my motivation and why I spend time innovating in healthcare.
Well, Stasis provides connected care technology. Now, can you explain, can you elaborate a bit what that is and how it works?
Yeah, totally. So connected care is a pretty big umbrella term, right? And really it just means, if you look today, oftentimes the nurse and doctor is a bit disconnected from knowing how the patient's actually doing, right? I joke with doctors about this, but it's 2023, and oftentimes the doctor knows more about the status of their Uber or their Amazon package than they do their own patient. So the idea of connected care technology is essentially to close those information gaps so that the clinical teams are informed about how patients are doing. And that way, if there's any kind of an issue or they see a certain trend, they can get on that, be more proactive. And, ideally, the goal there is to reduce death, to reduce recovery time, to get people happy, healthy, and home and, engaging in society again. So that's really what connected care technology is in a broad sense. And specifically for Stasis, we entered the market with a connected vital signs monitor. So this was like a super flexible, simple, cost-effective, like no infrastructure required, just plug and play way for hospitals, mostly in emerging markets, to be able to monitor their patients outside of the ICU. And so it's a FDA cleared, ran clinical trials, full validated medical device that we first brought into the market. We've since expanded on that, focusing a lot more in kind of what's become a bit of a buzzword, interoperability, which essentially means how do you help data move and communicate between different systems, whether it's equipment like vitals monitors and ventilators, or whether it's software systems like electronic medical records, clinical decision support and analytics, and things like that. So we mostly spend time now sitting in the middle, helping data that's trapped or siloed in different places. How do we get that data from point A to point B so that we can power these different connected care initiatives that health systems, insurance companies, and MedTech companies are all trying to bring in the market. And COVID's obviously been a bit of an accelerator to some of that.
Thanks a lot, Michael. And what inspired you to focus on connected care? I mean, as a business, business idea.
So the original idea came through a personal experience with my co-founder, Dinesh. So he was in the hospital in India with his grandfather. And his grandfather was in the ICU and started doing better. And so they moved him into a private area where, the family was staying there next to him. Now, what they often don't tell you is that when you're in the ICU, you're getting constant attention, you're hooked up to equipment, someone always has an eye on you. When you leave, that change or that care dramatically changes. And so what ends up happening is a nurse or doctor is coming around, say, every 4 to 6 hours, checking on you, checking vital signs, seeing how you're doing, and so on. Unfortunately, in the case of my co-founder's grandfather, he was doing better, but in between checks, he starts getting worse and no one knew about it. And so by the time that they found out it was an issue, it was unfortunately too late. They tried to stabilize him and rush him to the ICU, but they couldn't, and he passed away. And so we looked at this and said, well, wait a minute, there's doctors in the building, nurses in the floor. My co-founder is a trained EMT, so emergency medical technician. So he's sitting right there next to him. He could have done something. No one knew, right? There's this clear information gap where you don't know something's going wrong. And so how do you act? And so that really was a light bulb moment for us when we were both in engineering school in California. And this experience happened and we just started saying, wait a minute, there's got to be a better way.
Most definitely. And of course, our thoughts is with your partner, Dinesh, on this. Michael, what are the benefits of connected care for both patients and healthcare providers?
Yeah, definitely. I think that's a great question. You have to look at the different stakeholders involved in healthcare. And, I think one of the challenges that many, ourselves included, face when innovating in healthcare is there's a lot of different stakeholders, and those stakeholders, you'd hope, but they don't always have completely aligned incentives or priorities, right? I guess that's true in everything in life, but I think there's some especially big challenges in the healthcare industry around this, right? So breaking that down, if you look at it at a patient level, it's kind of what I said a little bit before, right? You want to get them home, you want to get them healthy, you don't want them sitting in the hospital, you don't want them getting worse, you don't want the infection risk. Oftentimes, especially in a lot of the markets that we're working in, if the head or, the main income earner of the household gets sick and is in the hospital for a few days, that can be really, really brutal for family, and that family can extend to the parents and extended family. And, there can be some really big repercussions when a patient is stuck in the hospital for a while. And especially if there's some surprise medical bills, in many cases, there's no insurance or insurance is not that great. So it can be really challenging. So, when you look at connected care, making sure that the clinical teams always know how those patients are doing and get to issue sooner. This has been proven around the world in many trials to reduce the length of stay. So you get patients home sooner, you reduce infection risks, you reduce the escalation of needing to go to the ICU. Essentially, you're reducing the chance of something bad happening once you've already treated them. And so all in all, it's just helps the patient, be home happier, sooner, healthier, less risk. From the clinical teams, I don't know, I've never talked to a doctor who's told me they don't care about their patients, right? Like, people who get into medicine generally do that because they want to provide care for other people and help them, right? And whether you're a doctor, or you're a nurse, or you're someone else, at least my hope is most of the people working in healthcare did that because they genuinely care about serving other human beings and caring for them. And I think it's really discouraging for a lot of clinical teams to be put in these very high pressure environments where patients are at the, teetering between life or death, and then not having enough data to be able to drive their decision making of who do you prioritize and when is an issue coming up and what do I do about that. So, if you think about it today, say you have no idea how any of your patients are doing, you're not connected at all, and you're going and you're doing your rounds around the hospital, say 2 or 3 times a day. You just go to the first room or the first one you think of, and you just kind of start going in order of, proximity and convenience to you, probably, right? And if something's going on, you don't know, you're looking at limited records, with big data gaps in between steps, and you try your best to piece it together with the data you have and say, we need to do X, Y, Z. But if you give someone constant connection and, 10 or 100 times more data points in that same period, Well, now instead of saying, all right, I'm just going to go to room 1 because it's next to me, I'm going to say, hey, well, actually room 10 over there, that patient's not looking like they're doing too well. Let me start there. Oh, I see there's actually an emergency happening over on 4-4 in the step down ward. I'm going to delay my rounds and I'm going to run down there and maybe get the rapid response team involved. And so it gives you the data to be able to actually make decisions about how you're prioritizing your time, how you're prioritizing your clinical resources, rather than just kind of, doing your best doing your best guess and kind of almost, flying in the dark a little bit. So connected care really gives you the data to not be, flying in the dark, so to speak.
And to always highlight priority, I guess, right?
Totally. Yeah. Yeah. Priority and just knowing if something's happening sooner than you otherwise would know.
Exactly. Yeah. Good. Michael, I'll let you clear your throat. You've been amazing so far. That was well deserved.
I am. Yeah.
Good. Well, tell me another thing. How does Stasis differ from other solutions in the market at this point?
Yeah, definitely. I'm obviously not the only one doing this, and thank God. I shouldn't be the only one doing this right there. What we're talking about is very important and a big systemic problem that exists around the world. So there needs to be a lot of people chipping away at this from different angles. The angle that I'm personally the most interested in is if you look at the US and West Europe, they've been innovating and trying to solve these problems for many decades now. And there's a lot of legacy that exists within the Western markets as they've tried and iterated and learned. And that's part of the innovative process. And thank God, because we've gotten to where we are. And a big part of it is all the learnings and trying that the West has done. A lot of Asia, the Middle East, Africa, parts of Central Europe, Latin America, so pretty much the rest of the world, they're doing this for the first time now. And so there's a bit more of a blank canvas. And that's not always true. There's definitely some legacy, or there's legacy in different ways, like more legacy of old equipment. But they don't have the same like health IT and the software and the medical records and the big server farms and some of the more legacy IT that has existed in Western markets. So where am I going with all this? Well, the rest of the world has an opportunity to learn from the West right now and what they did, but build it and do it differently based on those learnings and based on the requirements of those local markets. What is needed in a top medical center in the US and what is needed in a tier 2 city in India, different problems require different solutions. They're not the same. And so what we've really focused on is being that solution provider for customers that are really, doing this more for the first time, that don't have those decades of legacy and are looking at this and saying, well, we don't have tons of infrastructure. We don't have large IT teams and large amount of resources to do all of this. We don't have all the legacy of trying it for decades either. How do we go and do it right in a very kind of agile and as simple as possible way, right? This shouldn't be too big of a project. So, if I had to say kind of where do we differ in one sentence, our focus is really being plug and play for markets that, are just really digitally transforming for the first time now.
Good. I'm on to our next one now. Kind of like a follow-up question, I would say. So, what have been the biggest challenges that you faced while growing Stasis, and how were you able to actually overcome it?
Yeah, totally. Yeah, there's definitely not one challenge. It's
most definitely not. Sure. I'm all ears.
Yeah. Quite a roller coaster. The first challenge that comes to mind when you ask that is, it's the challenge that I think almost every company faces when entering the market, which is just how do you get that kind of how do you get the equation right of like solving the right problem in the right way with the right solution with like the right customer, and then how do you build that model in a way that's repeatable and scalable. you can always find a couple customers who have a problem, who care about it, who will evangelize you and will scream from the rooftops till the end of time how they love you and you've changed their life. That's that really early adopter type that I think every startup, well, not every actually, a lot of startups can find. Now, actually making that repeatable, scalable, how do you templatize that? How do you bridge that chasm, if you will, to go into more of that mass market is a really big challenge. And healthcare, I think, makes that even a little bit more convoluted with some of the dynamics, the way that money flows. The users and the buyers are usually not the same. And there's all these kind of convoluted incentives that come in play. And you're dealing with patient lives, right? So it's like, at the end of the day, if I download a photo sharing app and my photo doesn't share, my photo didn't share. If my solution just doesn't send data and the doctor doesn't see it and the patient dies, well, the patient died. So there's a little bit of a different risk index. So I think the challenge, honestly, has really just been, how do you kind of make all these ingredients line up to be able to manage your risk and deliver what you're doing in a very high quality way and deliver on your promise at an individual customer level. And then how do you scale that in a way to where the investments being made to the revenue you're realizing, lines up to be a viable and attractive business. I think healthcare has often been dominated by the larger players because there's a pretty big entry cost to work in a lot of healthcare, especially in what we're doing, right? There's a lot of overhead. There's a lot of additional things you need to consider. And so there's more people you need to hire, and there's more money you need to spend, and the timelines are longer before you can even enter the market, right? Before you can get your first, a dollar or euro of revenue. So that's been the challenge for sure. Not even a question. We've approached solving this in a couple of ways. First off, recognizing where our strengths are and where our strengths were not, and finding commercial partners who really could help us in bridging or kind of filling in some of those gaps where we weren't the best, right? They have large sales team reach. They have large existing customer contracts with the exact same customers we're trying to sell into. They have a strategic alignment with us. They have a gap in their product portfolio that we clearly can fit, right? So if you kind of find that right fitment with some partners, then we found that challenge I'm explaining can be overcome. And then also not being tied to the solution. There's this kind of saying of fall in love with the problem, not fall in love with the solution. And I'm a strong believer that as businesses grow, usually what got them where they are today is not what's going to get them forward. You need to make adjustments as you grow, as you learn, as the market evolves. And so that's awesome, man. We could probably do a whole podcast just on this topic. So, I think for us, really listening to the market and being brutally honest rather than being too enamored by what we were doing has allowed us to make some pretty big decisions where we weren't weighed down by the sunk cost fallacy of what we had done, and rather said, well, this is where things are going. Do we want to lose everything or not? Right? Because that's really what's actually at stake if you're truly being honest with yourself. And I think that's allowed us to make some changes. And so we continue to really be focused on how do we close this information gap, right? Between how the patient's doing and what the nurses and doctors know. That's a problem. That's why Dinesh's grandfather died. That's why millions of people every year die. And this problem hasn't changed since I started looking at it 10 years ago. But the solutions, how you implement the solutions, how you monetize on those, how you create a good business out of that has all been evolving. And so I think by really aligning to that market data and listening to that and evolving, that's how you can really overcome this, whether it's this company or it's another company.
Very powerful. Michael, I'm going to flip the coin completely now, and we're going to talk a bit about a bit of a more positive aspect of Stasis, which are the good stuff. Stasis has been recognized with several awards and accolades. Now, can you tell us a bit more about these achievements?
Sure, yeah. We've done a couple. So I think, the first one that The first one that comes to mind is very early on in our development. The International Finance Corporation, IFC, part of the World Bank Group, recognized the importance in the work that we were doing and gave us some support, including non-dilutive financial support to test out and really build what we were doing with the India market specifically. So the World Bank Group's support was really helpful, I think, in these early days, and that was helpful. A little bit later on, healthcare, as I was saying earlier, is one of those things where validation is so incredibly important to get adoption. And you really have to build this clinical credibility in order for doctors and nurses to trust you. So we ran years of clinical trials and working with hospitals and developing with, some of the best from one of the top medical centers in the United States, Cedars-Sinai Medical Center, to some of the top medical centers and then more smaller clinics in India, and really looking at that whole spectrum when we built our solution. And so after 4 years, after 4 years of really investing a lot into that, the FDA acknowledged our solution and said that it was, we went through all the approvals for the FDA. So that was one of the bigger achievements. I felt very, very proud for that one because it was a huge, huge undertaking. And then I guess one thing personally, I don't know how important it is or not. It seems almost kind of silly, but I at least appreciate it, is myself and my co-founder got acknowledged for the Forbes 30 under 30 list. So that was kind of a fun little thing to be added to.
That's amazing. That's amazing, Michael. Well, can you share a bit more of these success stories from customers who have used Stasis technology to improve patients' outcomes?
Totally. Yeah. Let's see. So I guess maybe one story that I like to think about. When we were just getting going, as I said, we really needed to establish clinical credibility so that people really trusted us. So we ran a study with our first customer, which is a big teaching hospital in Bangalore, India. And so we ran a 5-month study. We implemented our solution in 55 hospital beds across some emergency ICUs, general like medical surgical floors, kind of like wards, and private rooms. And the idea was, there's a lot of patients that are sitting in the ICU who are only there because they need that like attention and care, and monitoring, but they don't actually need to be in the ICU. And the ICU is pretty much always full. It's a very expensive resource to maintain for the hospital. And ultimately, if you're sitting in there because you need extra attention, but you don't really need ICU level care, well, you're actually taking the care away for patients who really need it. So the thesis was, can we use Stasis to successfully convince the nurses and doctors that we can safely move these patients outside of the ICU and manage them in some of these other areas using Stasis? So we did that across 55 beds. I think that covered close to 3,000 patients. Maybe it was 2,800 or something like that. And there's a few stats that I like to think of from this that I'm really proud of. One, and then this was like published in a peer-reviewed publication by the hospital. So this has been kind of peer-reviewed. One, we reduced the congestion in the ICU by 60%. So that, heavily congested ICU, limited resources for patients that need it. Well, we decongested that by 60%. So I really made sure the ICU resources were going to those who needed it. We decreased cardiac arrests by 400%. So code blues, right? Like a patient going into cardiac arrest usually ends in someone dying. We decreased that by 400%. And on the economic side, because the reality is all these clinical things matter, but at the end of the day, buying decisions are made with an ROI in mind. The patients that the hospital was caring for on Stasis, if you compare the cost of using them on Stasis versus if they stayed in the ICU and used those ICU resources, the cost of caring for those patients went down by 80%. So that's wow. Maybe one example of a success story.
Well, that is the example of success stories. I mean, those are big numbers, Michael. Those are definitely big numbers. So I recently found out that Stasis announced a partnership with a major medical technology company, which I'm guessing is true. Can you tell us a bit more about this collaboration?
Certainly. Yeah, you asked me earlier about big challenge and overcoming it. And, one of the things I said is finding commercial partners. So one of the announcements that we made was we partnered with Medtronic, who's, at least in revenue, the largest medical device company in the world. And have really been working with them to plug some gaps in their patient monitoring and respiratory portfolio so that they have a solution for markets like India and Asia Pacific and some parts of the Middle East and Africa and Central Europe and Latin America. And so, they have a set of solutions in monitoring that have been largely tailored and built for the West. And they see an interesting opportunity to take all of our learnings of a purpose-built solution for those market types and combine together the force of their company to really kind of scale out that solution for more of that emerging market segment. So we partnered up with them. We've trained up a number of their commercial teams and have been scaling up around India initially. And we'll see what else happens out of that one. But so far we've scaled up and they really represent us around the country of India right now.
Big news, Michael. So what's next for Stasis in terms of product development and expansion into new markets?
Definitely. So I'm very bullish on interoperability. And interoperability, as I said, I think right when we kicked off this conversation, is really around there's data that's sitting over here siloed, right? It can be trapped in different manufacturers, medical devices, or in different company software systems. And then on the other side, you have these different applications that need this data, right? It can be an electronic medical record that needs that so the nurses and doctors have a record on their patient. It can be different companies working in virtual care, whether it's telemedicine or remote patient monitoring, or even tele-ICUs, which is where like an ICU in a major metro might provide ICU remote care to ICUs, say in like tier 3 or tier 2 towns or rural areas, right? Or it can be in the home, as we've seen happen a lot as well. There's a lot of analytics and clinical decision support softwares that really need this data. And the list kind of goes on and on. There's a lot that I could say here, but there's essentially a lot of trapped data that's just kind of sitting there and not being used. And then there's all these people that really need this data to deliver on different digital promises to healthcare providers. So we essentially sit in the middle and say, all right, well, there's all these data streams here and we'll connect them to those data streams over there. And that's really what we've been investing in. That's a lot of where you see the future of our product is kind of in a two-part to this. One part is what's historically been called medical device integration, or MDI, which is integrating third-party equipment. And then the other side is more of like an integration engine, which is just a very simple, flexible way to integrate data in different formats across different standards into different systems. So pretty much get it from A to B, right? And just do it in different ways. So that's where we've been investing a lot of effort on the market side, or on the product side. And market side, I've kind of mentioned these big regions, right? My focus right now is we started in India. We have our eyes on Middle East, North Africa, the MENA region. And so we're setting up a operation for MENA based out of Dubai. And then, really we see that as an interesting gateway into a lot of the world. I have my eyes on different parts in APAC. And Latin America as well, and broader Central Europe and Africa have a lot of opportunities also. So that's kind of the plan. But right now it's interoperability product in kind of South Asia and the Middle East for now. And then we'll see where that takes us.
Okay. Michael, I'm curious. How does Stasis prioritize patient privacy and security in its technology?
Yeah. Well, I actually just posted a job for a director of security and quality. So if anyone listening is looking for a job, let me know. How do we prioritize it? Well, we're dealing with sensitive data. We work in the cloud, and I think we're honest and not naive to the fact that there's risks that come with that. Massive benefits too, which is the reason why we can be so plug and play and work in lower infrastructure settings and be so quick and so easy. But there is a risk that comes on the other side. Unfortunately, I think healthcare has been slow to adopt this mentality. Yes, we have things like HIPAA and GDPR more recently, and we're seeing this grow in terms of going to high trust and SOC 2 certifications, which is what I have my eyes on. So it is starting to move in the right direction. It's unfortunately been pretty slow. That really bothers me a lot. So a big focus for me and our team, and I've been really putting my money where my mouth is on this one, is really doubling down our investments in the security and privacy, really trying to become more and more leaders in cybersecurity within healthcare, and how do you implement the best technical decisions or policies or others that limit risk to this kind of data. So this is actually an area that I've been really trying to expand our competencies and expertise in. I think there's a lot that really needs to be done here. The one other thing I would say is I say all of this, but in terms of actually like patient health information, PHI, which is, really what is the protected here, because that's the part that helps you connect back to an individual. Without PHI, it's just anonymized data, right? We largely don't work much with the PHI. Most of the data and pretty much all that we're working on is all anonymized anyways. But nonetheless, I think it's really important that you protect this information. And I mean, if you look at where trends are going and you look at the amount of money that hackers can make for medical records, say if you look at a US medical record versus a US social security number, the social security number used to be one of the most lucrative things that you as a hacker could get. And last I checked, I think medical records now are paying 10 times more than a social security number. And that keeps growing. That's not going to go away. So I think the healthcare industry as a whole really needs to get behind this. And partially I think it's at a regulator level. They need to get more aligned and create some more standards and formats around this, because right now we're working with so many different communication protocols and so many different data standards, working between these different systems. And then, it's a little hard sometimes to work together as the good guys to keep out the bad guys when we're all kind of doing our own thing in our own language. So I hope the industry at large really takes this seriously over the next decade. The reality is I don't think we have a choice. So I'm just trying to get ahead of that.
Good. Michael, I'm still a little bit curious. I have just two more questions for you. I know you're a very busy man, and I'm so grateful for you giving us all this time. Literally just two questions, and you can also answer them quickly. Can you discuss any future plans of Stasis to integrate with electronic health records or other health systems, healthcare IT systems, maybe?
Yeah, totally. You say this like I'm itching to go. I'm loving this conversation. So
me too, man.
So for future plans, well, in terms of integrating with electronic health records or other health IT systems, one of the big things we're doing right now is doing integrations with a lot of the big electronic health record companies, and so that's a big focus for us today. We've done that already, and we continue to do that. And then in terms of other healthcare IT systems, I think that's when I look at a lot of healthcare IT, these companies are looking at, well, what's next for me? The market is really pushing them to deliver on these different kinds of digital solutions, as we were kind of talking about. And so they can only do that with the data that they have, right? Data often becomes this limiting factor. And how do you get the data in the right way to convert that into an action? I think we all know data isn't just valuable on its own. It needs to be able to be actionable. And If there's something missing for that, well, then it's only so good. So I think, we want to continue really working closely with a lot of healthcare IT companies and really understanding where they're facing some of those really big data gaps that we might be able to help with our technology or with the expertise in our company to plug some of those gaps. So we start seeing these companies and maybe ourselves in the future take really monumental steps in converting data into actionable insights that we're seeing actually really change the way that we're caring for patients. So if I can plug some of those gaps to power other people to do that, then that's something I'd be proud of.
Good. Now this last one is not for me. You've nourished me with so much amazing information, which I'm going to remember. This is for the entrepreneurs out there. What advice would you give these entrepreneurs who are looking to innovate the healthcare industry?
Yeah. It's a long game, and talk to the market a lot before you start building anything. I think there is amazing innovation opportunities and huge problems that need to be solved in healthcare. And we really need the best and smartest minds around the world to be working in it. Because I think we would probably all agree, healthcare is a human right. And in the end of the day, I don't care how successful you're doing in all other areas of life, whether you're amazingly happy or amazingly wealthy or amazingly in love. If your health is poor, it takes priority and ruins everything else. And so we as human beings have a responsibility to create a healthcare system that keeps us healthy and happy and living life the way, that we all want to. And so we really need the smartest minds working on it. And I think the advice that I would just share is when you're really looking at getting into healthcare, find something that really aligns with your fitment as a founder. I really believe in like founder problem fit and founder market fit and things. It's just as important, or it's critically important to get to a like product market fit, right? But it all starts with finding the right person aligned to the right problem. And so look for that, really be honest with yourself on that, and then just keep talking to the market over and over and over. There's this really big problem in healthcare of building in the garage and then bringing it into the hospital and thinking it's going to work. And so I think that recognizing that you really need to understand the market and find good fitment for you. You need to talk to them a lot and really understand the problem. And then be very adaptable in how you go about solving that problem, keeping a feedback loop of the market involved every step of the way. And be careful who you listen to. And this is the catch-22, because I'm saying listen to the market and talk to them, but the market can misguide you, right? There's this concept of getting piloted to death where you're never really getting paid or commercializing, and they keep saying, oh yeah, this is good, just add one more thing. So I think the last thing I would say, especially in the early days, is make sure you're setting up arrangements where, it can be a small amount of money, but eventually, and not too long after starting, you really need to be talking to the people who are actually the check signers and getting some money put behind something. It could be a trivial amount of money just to go through the transaction of getting paid. But when you do that, then you're actually hearing the real problems that people are going to prioritize and spend their money on. And those are the solutions that are actually going to scale in the market and be a viable business. The others, unfortunately, usually fizzle out.
Well, everybody, Stasis. This was Michael Maylahn talking to us today. I'd like to thank you very, very much for the complete elaboration, talking from the heart. Definitely a podcast to go down in history. Michael, thank you very, very much.
Well, thanks for having me. Really enjoyed this conversation.
Absolute pleasure.